Hello, I'm Charlene White. The Met Police is rethinking the way it deals with cases involving vulnerable people by drafting in the help of specialist nurses. Officers will work alongside medical teams in cases involving people suffering from mental health problems to make sure they get the specialist care they need. Today, Marcia Rigg, whose brother Sean died in police custody, welcomed the changes but said they don't go far enough. Here's Ronke Phillips.
This memorial photograph of Sean Rigg is now out of date. Tomorrow it will be exactly 5 years since he died. A schizophrenic, he was apprehended by police after he had a psychotic episode in the street.
On this particular day, the mental health care team had not administered his medication. He was actually 2 months overdue. They had not contacted the family, and Sean had become very, very unwell.
A resident took this picture as the arresting officers restrained Sean Rigg on the ground for 8 minutes. He was then placed in a van and driven to Brixton Police Station, where he was filmed slumped against a wall. He died of a heart attack. An inquest jury ruled the officers had used unsuitable force. This is the point where police first came into contact with Sean Rigg. If the measures had been in place then, the officers would have been accompanied by a nurse, and the outcome may well have been very different.
So I think if a nurse had been there, he would have been taken immediately straight to the hospital. His mental illness would have been recognised, and he'd probably have been alive today.
The Metropolitan Police is one of 5 forces to be selected by the government to pilot the street triage scheme, and could see mental health nurses supporting officers while they're on patrol, assisting police as they respond to emergency calls involving mental health patients, and giving advice to staff in control rooms.
Police officers absolutely need training in mental health, but they're never going to be the experts. And bringing the experts in mental health together with the people who are most likely to see crises in mental health first is the sensible thing to do.
But for the measures to make a real difference, families who've had bad experiences in the past also want to see other changes.
Essentially, you don't believe these measures are enough on their own?
No, absolutely not. If it's determined that the person with the illnesses has to go to a custody suite or a police station, there should be a dedicated suite for that person to attend, where they can have a proper full risk assessment.
All too late for her musician brother, but with the exact detail of how the initiative will work in London expected to be finalised soon, the scheme could be in place in time to help another mental health patient. Ronke Phillips, ITV News.
Well, joining me now is Marjorie Wallace, Chief Executive of the mental health charity SANE. Thanks very much for joining us. To pick up on a point that Marcia Rigg was talking about earlier about these custody suites, because in terms of place of safety, that's what it comes under in terms of the Section 136 of the Mental Health Act, that the police can take them to a place of safety. But at the moment, figures nationally show that about 10,000 people are put into cells rather than going to perhaps a hospital or a special suite. Would you like to see more of that happening?
Well, yes, that's why we welcome this scheme, because, I mean, to have 10,000 people in a police cell, I mean, it's quite shocking figures, because the place of safety is supposed to be the absolutely last resort, and yet it's being used as the only place. Now, the most cited reason for that the police give is that there are no available beds in hospitals or any healthcare units. And the police themselves often contact us and they say, we don't want to take them to a police cell, but we have no alternatives. They sometimes wait for hours for crisis teams, and they're using a lot of their time. They're not always trained, though they're sometimes extremely good with mental health patients in crisis. So there is a lot of sense in having a mental health nurse with the police.
So how would you like this to work? Obviously, they said that perhaps they could be going out on patrol with them, give a little bit more of direction to police officers and how to deal with someone that has mental health problems. What would you like to see happen?
Well, first of all, we'd like to stop people being taken. We hear daily of some cases where people are just taken away and because there's nowhere else they're in the cell. Now, can you imagine? Now, they're not being detained because they're being aggressive necessarily, or alcohol or drugs as a proportion, but it was actually 80% of people are being detained because they're suicidal or they are felt to pose a threat to themselves and self-harm. So can you imagine that if you're in that state of mind and then you're taken and you're treated like a criminal, you're strip searched, you're locked up in a cell. I mean, that can just trigger you over from being, you know, feeling terrible in the end of the world into even worse feelings. So to have a mental health nurse, it may be able to give the person confidence that they're being understood. But there are some questions that we would like to raise about this. I mean, there seems to be very little new money. I think about £2 million over the 9 areas. Each area is supposed to work this out.
Yeah. Differently, they have to decide how to spend the money, and it is quite a large proportion of people, especially for the Metropolitan Police, that are dealing with, because I think it's 15% of incidents that the Met Police deals with is thought to have some kind of mental health dimension attached to it. So it's a situation that effectively seems to be growing within London.
It is definitely growing. I mean, what they say is that they are effectively picking up the pieces for the failures of the psychiatric services, and with all the cuts that are happening to those services, they are picking up more and more pieces. And if you ever talk to the families, as we've seen today, it's often the police are the ones that come and give the sort of help and support to the families because the teams are so overstretched and the beds are being closed relentlessly. So what do you do with a person who's feeling really desperate and where do you take them?
Absolutely. We'll see exactly where this is going once they start talking about how it's to be implemented. But Marjorie Wallace, thanks very much for joining us.
Let's hope it really works this time.
Thank you.
Thank you.
Don't buy cheap